Hi, this is Dr. Jeffrey Hanna at Atlas Health Australia. And what I want to do in this particular video is show you a bit of something to give you perspective about what and this is a big giant model of the top of your head and then the top two bones in your neck, and the way that they can show up with regards what are called functional neurological issues. Now, I'm going to make this as a contrast with what's known as a pathological neurological issue. This is something that you can see on a MRI or a CT. It's a particular kind of lesion. It's going to be either a tumor, it's an infection, it's scar tissue, it's some kind of damage that you can see. And then we can look at that and say, oh, okay, yep, here is where the problem is. Now, here's the thing. So many people, they have different health issues and challenges, but they have had test after test after test after test, and nobody can figure out what is going on because they don't have the hallmarks of these pathological issues. I'll use the analogy, let's say that you've got your computer or your laptop or something like that. Now, what we're talking about with with a pathological issue is where there's a cracked screen, where the keyboard is damaged, there's some kind of external something or other going on that you can see. A functional issue, on the other hand, this is more like a computer virus. It's not something that you can see per se, but it affects the way that the system works. And so what I want to do here is I'm going to use the little model here to illustrate something that you do not always see that can be going on the different tests if you're not looking at it from just the right angle. So what I'm going to give you just as a bit more of an anatomy here is, let's say I take my two fingers and I put them right in the opening right through here. That is where your brain stem sits. And your brain stem, it's the master control center for all of the processes that go on in your body. There is nothing that communicates with your brain down to the rest of the system, be it your muscles, what you feel, or how your organs work, without going directly through or influenced by what is happening in that very particular opening right there. Now, this is going to be slightly larger than normal because a normal spinal cord at that level is going to be about the size of a pinky finger. But what I want to illustrate for you is that if or when there's an issue that's affecting either of these top two vertebrae, the top one is what lets you do this movement, and then the second one is what lets you do this movement side to side. They're very flexible, and as a result, they're susceptible to injury. Now, we're not talking about the kind of injuries that are going to cause things to go like this, completely severing the spinal cord. We're not talking about that. We're talking about something that is on a much smaller scale, but potentially no less significant. So let's say that you were to have an injury that caused things to shift even this much. Or maybe there was an injury that caused the second one, as we line it up there, to shift this much. And I'm going to draw your attention to that opening right there. So do you see how that changes? And then we do it like this, and then we do it like that. So what I'm showing you is that different movements of these bones in the upper part of the neck, they can influence the size of the diameter where your spinal cord, where that brain stem sits. Now, you shouldn't be saying, well, Jeff, your neck is supposed to move. Wouldn't that be happening all the time? Well, the answer is yes. If I'm going like this, there will be changes. If you were to look at scans of my neck, you would see a narrowing happening. But here's the thing, is that when I would bring my head back to a neutral position, that tension should go away. So let me pose this as the possibility. What would happen if, for example, you've had an injury, it didn't break, didn't dislocate anything, but it shifted things just enough, maybe even 1 to 2 millimeters. And as small as that sounds, because I get it, 1 to 2 millimeters is not much. But the normal movement for any one of these joints or any one of these bones is going to be approximately 1 to 2 centimeters. So we're talking about potentially a 5 to a 10% displacement or a narrowing of that opening. Now, your body's not going to break down immediately, but could you imagine 5 to 10% on something like a home mortgage? And then you just simply decide not to pay it. Do you think that maybe not immediately, but over a period of time, that is going to start to add up? And so when we're talking about a functional nerve condition, we're not talking about the big major kind of things that jump out on all of the tests. We're potentially talking about very, very, very small things, so small that we may not think anything of it, but that if you multiply that over a few months, a few years or even a few decades, it can start to make a very, very substantial difference. And suddenly that little narrowing, when your body is just not able to adapt for it anymore, that is when the symptoms, the problems, and the system is just not able to work the same way that it was before. The same as you would as if you've had the computer running and there's just been a bunch of junk that's accumulated in the background, there's gotten a few viruses and all that sort of stuff, and the system starts to slow to the point where you finally realize that there actually is a problem. Now, if that's the case, it means that so many of the different normal kinds of treatments may not work, because if you have no pathology, that's not going to fix it. So on the other hand, you need to figure out what is causing the disruption as far as how your body is working in order to get it to properly work again. And so this is one of the things that we look at in the practice in particular. We're looking at what our role is how is it that these two bones in the upper part of the neck could be affecting the way that your nervous system is functioning? Because if it's functioning correctly, you're going to be well. If it's not functioning correctly, then things can start to go wrong, and it can show up in oh so many places of the body. So I hope that this little video has offered you a little bit of extra information. If you have enjoyed it, please write a few comments for us down in the bottom. If you can think of somebody who would benefit from kind of this information, please do share this video with them. And then also be sure to like and subscribe to us on YouTube and check out some more information that we have on our website. Certainly, we're here to help in any capacity that we can, and right now it's just providing a bit of information about how your body actually works. This is Dr. Jeffrey Hanna at Atlas Health Australia, reminding you, take care of your neck. It is your lifeline to well-being.